So AT&T is showcasing its telehealth offerings here at the ATA conference, and I'm wondering what is the need today in today's world for the offerings that you have?
So when you look at the needs within healthcare, we've got hospital organizations that are needing to extend the reach to patients, whether it's providing additional patient satisfaction because it's easier to get care, provider satisfaction because they don't have to drive somewhere and do that. But we're also finding that hospitals are needing to extend that reach of care for specialists because there's a shortage of specialists in specialties like neurology, psychiatry, and dermatology. And so with that need, AT&T is enabling the provider to essentially reach out and bring the patients in to the healthcare system. We've also got some traditional healthcare organizations like provider networks that are wanting to reduce the cost of readmissions with patients not being readmitted back to the hospital and the hospitals bearing that brunt. Interestingly, there's some other organizations that may be job sites like energy, mining and infrastructure, like oil platforms, prisons, and mining companies that want to have healthcare on site. And so you're not going to have a doctor that's necessarily going to go to the mine or go to the oil platform, but they'll use the technologies that AT&T is offering to bring, again, the patient to the provider and not have to go to that actual physical location.
So you've mentioned a few of the reasons why a provider might go to AT&T, and I'm wondering why do providers seek out AT&T first?
Sure. So many people know AT&T is the phone company. And
Right.
so one of the key components to that equation within telehealth is to have the network. So AT&T can actually provide the end-to-end solution. We provide the network. We provide the video conferencing, which enables the physician and patient to have the face-to-face interaction. We also provide the medical peripherals, the integration of those peripherals into possibly the clinical workflow or the clinical information systems. And then we also provide the management and the hosting of that, so the service and support behind that once you roll it out.
And are there other compelling reasons that providers seek you out specifically? I'm sure you have competitors.
Oh, yes.
So-
Well, we like to think of it as a co-opetition because one
There
of the
you go.
things that we can do is we can do the full spectrum. We can go from beginning to end, but we also can do just a single slice of that. So whether it's the peripherals, whether it's the video conferencing, whether it's some of the best-in-class solutions for the medical applications, but we also have an entirely cloud-based offering that it's not just a product in our portfolio, but we offer the services around that. So we can offer it as a full-on purchase where they buy it and it's a turnkey solution, but we also offer the managed service where they don't have to pay for it as a capital outlay, but rather they can pay a monthly fee and we can install that, service it, support it, and have that out there so that organizations that may not have the budget up front, they can end up working that in on an operational expense.
And can you speak about clinical connection?
Oh, absolutely. So the real key to any of this is interoperability.
Yes.
If you can't talk from A to B or A to C to D, it doesn't work. So the interoperability piece is key for AT&T. So we have the ability with our clinical solutions to incorporate both the HL7 and the DICOM payloads and work with whatever system the hospital may have. And we may connect several different hospitals within a given system, and they may all have a different healthcare information system, and we can make that work with our vendor-neutral archive.
So it sounds like AT&T has been in the telehealth business for some time.
Yes,
How
ma'am.
long? When did this get started? Because as you say, many of us think of it as the telephone company.
Well, and again, if you think about how long we've been providing that, it's tough to kind of pinpoint when the telehealth piece is because telehealth is an ever-evolving definition. But we've been providing the network to hospital organizations. We've been providing the network for the main office buildings and the physicians. But we actually have a dedicated division of AT&T called 4Health, and our virtual care platform is enabling the virtual visits between patients and physicians.
And can you speak a little bit about ROI? Because everyone these days is, of course, interested in return on investment. What do you tell your prospects?
Well, we look at it in a couple different ways. So ROI can be anything from is the patient satisfied and is the provider satisfied with the level of care they're able to give to the patient or from the provider side. We also look at it as the speed in which we can deliver care to the patient. So in something that's time sensitive like like a stroke where time is of the essence, we enable the virtual consultation and the speed of delivery. We also can look at the decreased cost of transport by using video conferencing or some of these other telehealth applications. If you're paying a physician X amount and then they have to drive 3 hours, that's not a very efficient use of those 3 hours with them driving. So by them not driving, that's another great return on investment. The other thing that AT&T has that's very unique to the virtual care and the 4Health platforms is our ROI benefits estimator. So we can work with the customer and we can say, you're rolling out a telehealth program, and we can plug in their different metrics, whether it's a particular specialty, whether it's the reimbursement levels that are varying by state or by particular specialty, and then the type of program they want to do. And then the sales manager, sales account manager, or the 4Health team can actually come in and show them what that ROI will be based on those particular parameters that the customer gives us.
Great. I bet that's a great selling point.
It's a lot of fun to walk through with them because their eyes light up when they begin to see the zeros adding up at the end of the day.
All right. Thank you very much.
Thank you.